let's talk about how to release the lateral pterygoid muscle. This muscle is little, guys, but it is fierce. The lateral pterygoid muscle runs from the pterygoid plate in the sphenoid bone, which is a skull bone, all the way to the jaw joint itself. The upper head of this muscle attaches to the little disc of cartilaginous tissue in the joint, and the lower head actually attaches to the jawbone itself. This muscle, when it goes into spasm or becomes dysfunctional, it can wreak havoc. It can cause headaches, it can cause jaw pain, it can cause pain behind the eye, pain into the ear, and yes, even specific tooth pain. So specific that it feels like you need a tooth extracted or you need a root canal. Like I said, it's little, but it is fierce. It is about the size of the end of my pinky. So to release this muscle, you're gonna need a pinky actually, guys. And to release the left lateral pterygoid, you need the right pinky and vice versa. So to release this muscle, you're gonna take your pinky and you're gonna turn it. You're gonna turn it so that the skin part is by your cheek and the nail part is by your teeth. You're gonna actually take it in your mouth, you're gonna open as big as you can and go as far back and as far up between your cheek and your teeth as you can. Once you get back there, then you're gonna close about halfway. That's super important, guys. When you close halfway, you're gonna get more access. You're gonna be able to get further back and further up. And that's sort of the trick to this. You have to close halfway. Once you close halfway, get about as far up and as far back as you can. And it's kind of gonna hurt. So try not to use your nail or cut your nail pretty short before you do this. Once you get to that spot way in the back where it's tender, apply pressure there. You're gonna apply pressure for about 10 seconds, 10 to 15 seconds or so, and then you're actually gonna kind of change the angle of your pinky and apply pressure again. And you're gonna do this 2 to 3 times, 10 to 15 seconds each time. Then you're gonna come back out. You can do that 1 to 2 times a day. Don't overdo this because this muscle is already usually pretty mad. And it shouldn't feel great when you do this. It should kind of hurt. So kind of go by that, know that it should hurt. But what that pressure is doing is it's bringing fresh blood flow, fresh oxygen to that muscle, and it's promoting lymphatic drainage in that muscle as well. So toxins, lactic acid that build up and make that muscle sore. So here's the demonstration. Pinky. And there you have it.